There's a part of your brain that promotes movement, and there's a part of the brain that inhibits movement, and they're balanced, so people have normal types of movement. What happens in Parkinson's disease is that the area that promotes movement is decreased. This area, the area that inhibits movement, takes over. Well, why don't we just increase this area of the brain and get that back? And we try to do that with some dopamine and everything. But there are complications with that, and some of the problems that you can get are the dyskinesias, which are the abnormal movements, and you can get motor fluctuations.
What we do is we start medication as soon as the patient becomes sufficiently symptomatic that they want to take medication, and we give them just enough that they're able to function well. We don't try to get rid of all their symptoms and signs, because if you try to make the patient perfect early on, you get into the symptom fluctuations earlier. And when you're starting to have those symptom fluctuations, all the medication adjustments in the world are not going to have a major impact, not nearly as much as the surgery.
Deep brain stimulation is a misnomer. We're not actually increasing the activity of the brain. What we're doing is we're passing some electric current there that scrambles the signals coming out of that area of the brain that inhibit movement. You're trying to make it equal to the area that promotes movement. And the results are pretty good. If you just put it in who got worse, who was unchanged, and who got improved, you can see that that the majority of the patients were improved. Put it in a pie chart, you can see 92% of the patients had some improvement in their Parkinson's symptoms. You know, I show people this slide here, and it shows the pulse generators and the wires and everything. And people said, well, I don't want anything that's outside my skin. And I said, well, no, this is a cartoon. It's all underneath the skin. And that's the pulse generator and the electrode. It's programmed with this little computer. The advantage of this is that it's flexible, and you can get benefits from different sites. If one site doesn't work, you can move the electrode to a different site. The disadvantages is that you can cause a stroke with this surgery. It's pretty rare, but it happens. Another disadvantage is that you've got implanted hardware, which sometimes can get infected, or wires can break. Here's the picture of that electrode that goes into the brain. The spot that we want to hit is sort of between the sensory pathways and the motor pathways. We want to make sure it's just stimulating this area. All the time, Dr. Elbe is there to check make sure that there's no side effects. Here again, Dr. Elbe is talking to the patient while the electrode's sticking in his brain.
We traditionally have waited until the patients were pretty advanced. The problem with waiting too long is that the patients get older and they're less able to withstand the surgery. And also, if they develop cognitive impairment, then they don't qualify for the surgery. So the trend is to do it earlier.
We want to do it where it makes a difference in your life. I mean, if someone if they're end-stage Parkinson's disease and you're going to be in a nursing home no matter what, well then, why would you undergo the risks of surgery? But if it's going to make a difference in your life, where you're going to be able to play with your grandchildren or go out and play hockey or something like that, then we want to make a difference in your life.
There are patients that don't do better. Now, if you look at people with tremor, just tremor, no matter what kind of tremor really, whether it be Parkinson or the essential tremor, 80% have a very good result. And then there's another 10% that are better, but boy, I'd still like to get rid of more of the tremor. And I would say about 1 out of 10, it just didn't help nearly as much as we would have liked. And so some patients, like I said, do very, very well. Some patients don't. Some patients respond very, very well to the surgery, and some don't. It's not a guarantee.